Marshall.
Thank you, Madam Chair. Let me follow up on Senator Scott's concerns that people back home having an allergic reaction to the policies. It's actually an anaphylactic shock that the people of this nation are having. You know, my grandma had many old sayings, and one of them is that two wrongs don't make a right. Two wrongs don't make a right. And certainly I was not here in this body with the reconciliation package, but the arguments is basically what I'm hearing from the other side is that two wrongs would make a right. When I hear my friends, my colleagues across the aisle talk about health care, we agree on so many of the same goals. So many of the same goals that we want every American to have access to health care. And I think they do. I really do think that they do. We share that same common goal, and there's always opportunity for improvement. I'm so proud that any hospital I was affiliated with, any clinic we did, saw every patient. We never did a wallet biopsy. We saw everybody, and we took care of everybody. I was so proud to help sponsor health departments, county health departments that use local, state, and federal funds, and to provide free family planning clinics wherever I worked. So proud when I got to Congress to help fund community health centers, which do a great job. I just don't know where people would come off saying that Americans don't have access to health care, because I think that they do. I do think that they have access to health care, and that's, again, the goal we share in common is how to have true access to meaningful health care at an affordable price, and that's why I came to Congress. One of the reasons was to make sure that we had quality health care at an affordable price, but where we disagree is on how to get there. One solution would be a Medicare for all, socialized medicine, and mine is the opposite, where I want to give people more choices, but drive down the cost of health care. I think we all acknowledge the cost of health care is just almost unattainable. It is absolutely a nightmare for so many people, the cost of health care. I'm glad to see Medicare Advantage prices stabilizing. That's a situation where we're giving people more choices, and it's driven down the price of health care and stabilized prescription drug prices. The prescription to drive down the cost of health care is more transparency, more innovation, and consumerism. Consumerism being letting patients be consumers again. Otherwise, we're going to end up with diluted health care, rationed health care, and lack of innovation. Several colleagues have mentioned the innovation of new vaccines, miracle vaccines that have saved millions of lives. The ability of a pharmacy to have new drugs that instead of a person having a liver transplant, we have a medicine they take once a week for 12 weeks and it cures them of hepatitis. Those innovations aren't going to happen if we overreact and we put too many lids. I think we need to talk about the true cost of what's driving up the cost of health care, a meaningful discussion about the cost of prescription drug prices and who's making that money. We need to talk about the administrative burden that we've created in health care, where we've seen the numbers of health care administrators go up exponentially in my career in medicine, but the number of physicians staying flat. When we talk about driving down the cost of health care, I'm shocked to think that we want to pull the rug out from under the physicians who ran to the sound of the battle and saved so many lives, and we want Medicare reimbursement cuts for physicians going forward this year. We already have a shortage of physicians. We have a shortage of nurses, and our policy is exacerbating that. I do think there's very meaningful discussions that need to be had in this, but two wrongs don't make a right. Thank you, Madam Chair.
Thank you. Are there any other